Good morning. I'm Woody Dahmer. I'm the Director of Managed Care Services and Compliance. And I'd like to welcome all the providers to our updates session of the October Medicaid Fair. And I also want to thank in advance all of our presenters today, including those from our CMO partners. At this point, I will turn it over to Marvis Butler, my colleague. She is the Senior Manager for Georgia Families 360. Thank you. Marvis?
Thank you, Woody. Good morning again, and thank you everyone who's decided to sign up for our CMO updates. I think we have over 450 registrants for the session. Today you will hear a brief presentation from each of the CMOs. That's the Amer Group, Caresource, and Peach State Health Plan. After that, we will have question and answers, and Gainwell will actually handle the questions that are coming in. Any questions that are not answered during the session, we will reach out to the CMO so that they can respond to you individually. Next slide. And again, the mission of the Department of Community Health is to provide access to affordable, quality health care to Georgians through effective planning, purchasing, and oversight. Next. And again, our purpose is to shape the future of a healthy Georgia by improving access and ensuring quality to strengthen the communities we serve. Next slide. All right, so now I'd like to turn it over to Amer Group, who will provide a presentation followed by Caresource, then Peach State, and then our Q&A panel.
Is Vivian Scott able to?
Good morning. Can you hear me? Good morning. Can you hear me?
Yes, go ahead. Thank you.
Thank you. I was having trouble unmuting. Okay, great. Good morning, everyone. My name is Vivian Scott. I'm the Director of Provider Experience for Amer Group. On behalf of our Plan President, Melvin Lindsay, and the entire Amer Group leadership team, we are honored to be here today. This morning, I'll give a brief overview of Amer Group and highlight a few of our activities over the past year. Amer Group is devoted to serve our communities, providers, and members of the Georgia Families and Georgia Families 360 program. Our mission is to provide real solutions for our members who need a little help by making healthcare system work better and while keeping it more affordable for taxpayers. We currently serve over 557,000 members in both the Georgia Families and Georgia Families 360 program. You see our value proposition listed here. And in addition to that, we've had over 15 years experience serving the great members of the Medicaid program here in the state of Georgia. We have over 35,000 providers in our network and over 325 years combined local leadership experience. Next slide. We are also very proud to be the selected plan to manage the Georgia Families 360 program, caring for this most vulnerable population of children and adolescents. You see here some of our initiatives and community engagement supporting this program, and I'll highlight just a few of these. Under human trafficking, we have had a commitment and have established several initiatives aimed to combat human trafficking here in Georgia. These include partnership with the Alliance for Freedom, Restoration, and Justice and Street Grace to support the CSEC badging program. In 2020, we began a sponsorship with Wednesday's Child, a media-based child-specific recruitment program utilized to heighten awareness on adoption and to improve the lives of children in foster care by helping them find permanent, loving, and safe adoptive homes. In March of 2021, Amer Group partnered with Chris 180, one of our providers, to facilitate training for 35 Chris 180 therapists in DBT to enable our members to have greater access to in-network DBT therapists. Next slide. So here I want to talk a little bit about COVID and highlight some of the challenges and our response to some of these challenges. Over the past year and a half during the public health emergency, we've all been challenged on ways to ensure that members receive needed care as a result of COVID-19. And on this slide, this represents some of those challenges we've addressed, such as access to care, discrimination, unemployment. And on the green side, you will see some of those solutions that Amer Group implemented in order to address some of these disparities in the state. Next slide. Our marketing team, who is just a dynamic group of people that perform very generously day to day out in the communities, partnering and working with both community organizations and providers, also worked very diligently over the past year and a half to ensure members were receiving vaccinations and just to help with public awareness. And on this slide, we just wanted to highlight some of those partnerships and events and where we held those throughout the state and the number of vaccines that Amer Group assisted to ensure that members were getting coverage for COVID-19 and getting vaccinated. We continue these activities and continue our partnerships and certainly welcome any of our providers and community partners who are interested to help us in supporting and giving greater exposure for members and other members of the community to receive COVID vaccine, the vaccinations. Next slide. And last, I just wanted to give a very general highlight and awareness around our self-service website on our Amer Group provider portal, particularly our Availity tool, which is a multi-payer portal, not just utilized by Amer Group, but it does allow providers to have a single sign-on access to perform many activities in this tool, such as verifying eligibility, submitting claims. You can perform claim status inquiries, file payment disputes for multiple claims and appeals, and also make prior authorization requests for those services not required to be submitted via the GAMIS portal. And this concludes our presentation for today. On behalf of my colleagues on the call and the rest of the Amer Group leadership team, we want to thank you for your time and attention this morning, and we wish everyone a great rest of the day. Thank you.
Hi, Brenda, can you hear me?
Yes, Liz, go ahead.
Great. Good morning, everyone. My name is Liz Brady. I'm the Director of Operations for the Caresource Georgia market. On behalf of our market president, Jason Bearden, and the entire Georgia market team, we appreciate the opportunity to be here with you today and the partnership we share serving the members of the Georgia Families Program. Next slide, please. An operational highlight we'd like to share this morning is our claims first pass accuracy. The results from the last 12 months show a positive improvement of 7.3% in our first pass accuracy rate. Here we're comparing the number of claims that have a Caresource initiated adjustment. This could either be due to a Caresource error or an adjustment due to a dispute or appeal to our total claims received. This is a metric we track to identify and monitor the effectiveness of ongoing operational improvements. We monitor improvements we've developed with the root cause analysis of adjustments. Through a Power BI dashboard tool, we have visibility to all adjustments and root cause to quickly identify trends and deep dive on resolution, which causes subsequent claims to pay accurately on first pass. We're also using an artificial intelligence denial anomaly tool to quickly identify early anomalies for remediation. Next slide, please, Brenda. Caresource is pleased to share that we've expanded eligibility for our Quality Enhancer program to all participating physicians and federally qualified health centers effective August 5th, 2021. The Quality Enhancer program drives high-value services in your practice by focusing on target quality measures, such as child and adolescent well care visits, immunizations, and screening services. When you participate in the Quality Enhancer program, your reimbursement is based on your submission of claims. Incentives range from $5 to $25 per service and apply to primary payer claims. For additional information, please visit our website at the URL provided here. This link will take you to additional information, including the applicable coding requirements for each quality measure. Now I'm going to turn the presentation over to my colleague, Tony Campisti. Thank you.
Good morning, and thank you, Liz, for highlighting the wonderful operational improvements that we've made at Caresource and showing the positive trends. It's really great information for our providers today. Also, the Quality Enhancer program, we're very excited to roll that out to all of our participating providers. We want to continue to offer additional incentives for all of you while helping our members achieve the quality care that they need. So it's really great updates. Thank you, Liz. Good morning, everyone. My name is Tony Campisti, and I'm a manager of contracting and service with Caresource. And it's really great to be with you all this morning. And today, what I would like to do is just do a brief overview of the Caresource provider portal to ensure that we're all comfortable with registration, sign on, and we want to make sure we're all comfortable so you have the tools at your fingertips to get the information you need when you need it. So since our inception in 2017 in Georgia, one of the focuses that we've had is to listen to our provider feedback. So we want to hear from you so we can continue to make enhancements and improvements to our provider portal. We're proud of the enhancements that we've made since inception, and we plan to continue to improve the provider portal, again, to help you. So first, what I'd like to do is actually take a look at the top left. So this is what you see when you go to our provider portal, and we see that it shows Georgia Provider Portal. And of course, this seems obvious because we're all Georgia providers, but I do want to highlight this for one reason specifically. Caresource does operate in multiple states, and I know Google can kind of become our best friend sometimes when we're searching. And so if you were to Google Caresource Provider Portal, there is a chance that Google would take you to a different state that Caresource operates in, which of course may create login issues. So if you ever have login issues, that may be a reason why. So I do want to highlight that first point there. When we look at the middle of the page for our provider login, it's important to note that the way Caresource manages the provider portal registration is at the tax ID level. So what that means is that if you have a practice, say with 5 physicians, you can register any of those 5 physicians, and then once you have that username and password, you log in, and the portal will give you all the information for that specific tax ID. So there's no need to register multiple times as long as all providers are linked to that tax ID number. Up under the login button, we do have the register for an account option. And if we can kind of go to the next slide, it's going to bring up a window here. And one more, actually. It'll bring up another one. So it's important to note that Caresource does allow participating and non-participating providers to register for the portal. So of course, for our contracted or participating providers, the information needed here to the left, you will already have that information. You will receive that information as part of your welcome letter after the contracting process is completed. And so it will be a simple process of just entering in your information from your welcome letter, reviewing and accepting the agreement, and creating the username and password. So it's a very simple, streamlined registration process. Again, for our non-participating providers, you do still have the ability to register, but you won't have a welcome letter, so you will need your Caresource provider ID, which you can obtain by reaching out to the Caresource customer service department. One enhancement, and it's a recent enhancement that we're really happy about, and again, this came from our provider community, is enrollment status. So you have a scenario where you've recently submitted your contracting request, and we all want to keep up with the status and where that is. So if we look to the middle of the right screen here, we have new provider setup and check enrollment status. And so again, that's a new option. And if you click that link, it will show you the status of your application, so you can track where that process is. We also have, we keep the messages portion at the bottom of the screen updated. So if there is any important messages that we want to get out to all of our provider community, we do make a point to keep those front and center for you. So we can go to the next slide. Again, Caresource is all about giving you self-service tools. So one thing that we have on our main caresource.com website, up under training and events, we have a provider portal education series. So today I know we went over some basics, but the great thing about this link is that we actually have videos that give you step-by-step tools for specific actions that you can do on the provider portal. So I highly encourage you to check that out if you have any questions about, detailed questions about the provider portal. And we can go to the next slide here. I think one more, yeah. And so this provider portal solutions just gives us all a breakdown of a more comprehensive list of actions and benefits that the provider portal offers you. So again, at Caresource, our focus is to ensure that you can be efficient in your practice operations. And we believe that our provider portal really helps with that, giving you 24/7 access to the information that you need when you need it. So that is the end of my presentation this morning. It's really great being with you all today. I know I speak for everyone when I say I can't wait to do this in person. We definitely miss that aspect of the Medicaid fair, but we really appreciate everyone with DCH organizing this, and I thank the provider community for being here. Thank you.
Thank you. Good morning. My name is Andre Greenwood. I am the Vice President of Provider Performance at Peach State Health Plan. This morning, we bring you greetings from our plan president and CEO, Mr. Wade Rakes, and the entire Peach State Health Plan team. Next slide, please. Here at Peach State, our mission is transforming the health of our community, one person at a time. We have over 650 local employees statewide, and we have been a care management organization since 2006. We have over 956,000 Medicaid members. Across all 50 states in the country, we have a government health care program with having Medicaid in 29 of those states and also 3 international markets. Next slide, please. Peach State Health Plan fosters strong partnerships with our providers, offers an integrated care model, establish trusting partnerships with our state and federal partners, and address barriers to care in our communities. We keep the member in the center of everything we do. We have different programs with member concierge services, continuing with member education, enrollment and eligibility. We have numerous of community health events and health fairs. We have a very robust and easy to access member portal. We have plenty of member rewards and programs, community health services, and easy to find our members. With our providers, we focus on communication, holding ourselves accountable, visibility, and continue to educate our providers. By doing this, simplifying administrative procedures, we have a web portal and authorization tools that are easy to access, supportive provider relation and quality engagement liaison teams, as well as innovative clinical programs for the patients and members that all the providers serve. Next slide, please. If serving is beneath you, then leadership is beyond you. Over the last year and a half, the whole entire country and globe was affected by COVID-19. Here at Peach State, we had numerous of COVID-19 panel discussions where we partnered with Morehouse School of Medicine and the Family Health Centers, and also with the Okefenokee Chamber of Commerce and McKinney FQHC. In those different panel presentations, we had over 1,000 participants, and at those presentations and panels, we also had COVID-19 vaccines that were also administered. Throughout the state, we had back-to-school events where we had over 2,500 attendees, and with these events, we had over 700 Peach State Health Plan members. And at that particular event across the state, 75 individuals received the COVID-19 vaccine. Next, we have Jennifer Morris, who's going to go over our provider portal and provider self-services, and also the different tools and functions that we have offered to our providers. Jennifer, take it away.
Thanks, Andre. Good morning, everyone. Again, my name is Jennifer Morris. I am the Provider Relations Trainer for Peach State. And you can go ahead and go to the next slide. I'm going to talk to you guys this morning a little bit about the public website and the secure provider portal. So on this first slide, you see provider resources. Basically, provider resources section on the public website is a one-stop shop for our providers. As you can see from the screenshot in the middle of the slide, there's actually lots of information that is provided to our provider network. We have any types of manuals. We have different types of forms that we utilize at the plan. Eligibility verification. We have behavioral health information, prior authorization information, and of course your provider relations territory list. That is not all of the information that is there, but that's just what we could see here and some of the highlights. You can go to the next slide, please. On the top left-hand side of your screen, you will see a screenshot of the provider handbook. So Peach State does have a searchable provider handbook on the website for providers to access. Down below that, you will see PDL detailed information. We do have a pharmacy section on our public website, and on there you can find information about RSV, cancer treatment. You have information referencing the Georgia Families and the Peach Care for Kids preferred drug list. You have, of course, the Planning for Healthy Babies PDL, and then you also have listed there our quarterly PDL updates. Now, on the right-hand side of your screen, you will see the topic that says clinical and payment policies. We do list all of our clinical and payment policies on the public website for all providers to access. We have our clinical policies, behavioral health policies, vision policies, specialty pharmacy policies, and our payment policies. So all that information is at your fingertips on the public website. Next slide, please. Peach State does also list our contact information and detailed information on the footer of every page of the public website. So on the left corner, that top screenshot, you will see on the left side of that, it says contact us. If a provider was to click on that contact us link, it would take them to a screen where they would be able to submit a secure message to the health plan. Now on the right-hand side of that screenshot, you would see where we have the member services contact information and days of operation and hours. And right below that, you will see that we have the provider services contact information and office hours. Now, right below that, you have the provider directory information. You can search our provider directory now by a provider name, a specialty, and a category type. So if you look at the screenshot there at the bottom right-hand corner of your screen, you will see that we have different categories that you can choose from. So if you're looking for a specific type of provider, or if it's a provider versus a facility, you can click on that and it will take you to those categories. Next slide, please. Now we're going to look a little bit into the Secure Provider Portal. So providers have the ability to submit, process, edit, rebill, correct, reconsider, and adjudicate claims electronically through the Provider Secure Portal. On the top left side of your screen, you will see a screenshot, and the top screenshot shows an orange box that says Create Claim. So providers can click on the Create Claim option, and it's going to open up a second box, which is the second screenshot that you see there in the middle of your screen. Will give you the opportunity to choose the type of claim that you would like to submit, whether it be a CMS 1500 or the UB04. Now, in the bottom right-hand corner of your screen, providers also have the ability to submit corrected claims and do claim reconsiderations through the Secure Provider Portal. Next slide, please. The Secure Provider Portal offers providers the ability to attach different document types to their original claim submissions, corrected claims, as well as the claim reconsiderations. So in the screenshot that you see here, you have attachments. This is where you as the provider can attach different documents to your claim submissions. There is a note that says do not send password protected files because of course we would not be able to open those. And once you actually have attached the item, you have to click on the word attach for it to actually attach your file. So you would choose your file, then to the right of that it says attachment type. You would choose the attachment type that you have wanting to attach, and then you would click to the right of that, you see the button that says attach. You would click attach to attach those files. Now once you have attached those files, they will show up directly below where it says choose file. That way you can validate that your information and the file you wanted to attach is in fact attached. Once you have validated it is attached, in the bottom right corner you see the green button and you would click next and then it would submit that information to the plan. Next slide, please. This next slide talks about the remittance devices. With Peach State, you have two ways to get your remittance devices. The first one on the left-hand side of your screen is the new PDF version of the remittance device that you can get through the web portal. And on the right-hand side, you also have access to get that information through PaySpan. So this does now conclude the Peach State Health Plan presentation. We look forward to our continued partnership with each and every one of you and want to thank you for your time and have a great day.
Thank you.
Thank you for all of that great information. At this point, Catherine Ivey with DCH is going to cover some frequently asked questions and also questions that were submitted beforehand. And so thank you, and go ahead, Catherine.
Yes, thank you, Brenda. We had a number of questions that were specific to the CMOs that were submitted prior to the workshop or prior to today. And I thought I would go ahead and start with those questions and ask the CMOs to just respond to those. Some may require responses from each of the CMOs. Some may be a question that can sort of be answered in summary by one CMO. And there are a few that actually can be answered directly by DCH. So I'm going to take those first. There were a couple or three questions that came in from providers about coverage of COVID vaccine. Specifically, there was a question that came in about coverage of the Johnson & Johnson COVID vaccine. There was another question that came in specifically about vaccine coverage, or it was a general question about that. And I wanted to just go ahead and let the group know, in case this is your question, that the vaccine itself is not paid for by Medicaid. The vaccine is covered by the federal government, so there is no charge for the vaccine itself. Medicaid is covering the vaccine administration. And so the administration fee is covered by all of the CMOs, and it is a flat administration fee that's provided, that's delivered to any provider that administers the vaccination. And it is completely blind to the type of vaccination. So it doesn't matter if it's the Pfizer vaccine or the J&J vaccine or the Moderna. It's just irrespective of that. So that was kind of an easy question. There's another question about eligibility, and it says, how do families select to remain on straight Medicaid, that would be fee-for-service Medicaid, and not be automatically switched to one of the CMOs when they have a disability? The answer to that question is that when a person has been determined disabled by the Social Security Administration, they're considered to be in a category of Medicaid that all Medicaid agencies and CMS considered for aged, blind, and disabled. A person may have a disability that can be short-term, but they've not been determined disabled by the Social Security Administration. And then in Medicaid's eyes, that individual is not disabled because we rely on the Social Security Administration's determination of eligibility. All individuals who do not fall into that category of age, blind, and disabled in Georgia are covered under the care management organizations. And that is, it's a system determined decision. And so if the person does not have that particular class of eligibility, age, blind, or disabled, then they're automatically placed in a CMO. The next question is, there were a couple or three questions about enrolling a provider into the CMOs. So this is an area of terrible confusion, and, because we use two different terms for that. The Department of Community Health, as the Medicaid agency, is the agency that must enroll a provider. And that's the process that takes you through the certification and verification. And so that's the enrollment process. Once you're enrolled, we send a complete listing of all of the enrolled providers to the CMOs, and the CMOs contract with those providers that they may need in a particular area. Now, I want to also call on the CMOs to answer this question because there were specific questions that were submitted by providers about, please describe the process for contracting with a CMO. There was another question about how to register with other CMOs in case you're only contracted with one. And so I'm going to turn that over and ask the CMOs to respond to those questions about contracting. And I'll start with Amer Group. If you could, Brenda, unmute the Amer Group representative. Can the Vivian, are you able to be heard?
Yes, I'm here. Can you hear me?
Yes, we can. Thank you. Would you like to go ahead and talk us through your contracting process?
Sure. And actually, Monica Lester, who's the Director of Network Management, is also on. Is it possible to unmute her and she will provide a response?
Yes, one moment.
Thank you.
Good morning. This is Monica Lester. Can you hear me? I had an option to
Yes.
unmute. Okay,
Yes.
great. So I'll walk you through the contracting process. A provider needs to use the email address GA1CRED, so GA1CRED, all one word, at amerigroup.com, express interest in contracting. If you can provide the specialty, your service location, the county is acceptable, and we will take that email with the information and it will be forwarded to the appropriate contractor who will contact you. And the information, of course, we will collect a W-9, and once we receive that, we will send you a contract for signature. And then once you send that contract back, we will submit it to countersign, and you will get a welcome letter with your effective date with the executed contract attached.
Okay, thank you. Does CareSource want to address that same question? Liz?
Good morning.
Okay, go ahead.
Catherine, this is Tony Kempisi with Caresource. Yes, so we are really proud that we've been able to streamline the contracting process in partnership with the state's administrative simplification process. So as Catherine mentioned, we receive the credentialing file from the state. And so since we have the information already, when you go to submit your contracting request, we really only ask for a few pieces of information. So I'll tell you first where to go to do that. So at caresource.com, just our main website, not the provider portal, so caresource.com, you click on the provider option, and there's an option that says not a provider, become a provider. And so that's where you click. So just caresource.com, provider, and become a provider. And that will ask you then to select the product that you want to contract for. So we're here at a Medicaid fair, so you would choose Georgia Medicaid. And again, because we already have your information from the state, we're only going to ask for your tax ID, your NPI, and then your contact information. And so you'll submit that. You'll receive an email, which will have all the steps to finalize the contracting process. So it really has been streamlined where we just don't ask for a lot of information because, again, the state has done a great job with the administrative simplification process and is getting that information to us. So that is the process for Caresource.
Thank you. And Peach State?
Yes, if you can unmute Dwayne Flowers. He's our Senior Director of Contracting here at Peach State Health Plan.
Okay, he's been
Good
unmuted.
morning, everyone. Can you hear me? This is
Yes.
Dwayne Flowers.
Great, go ahead.
Our process is also very simplex. Essentially, if you're interested in becoming a provider, there's a couple of things that I want to go over. If you're affiliated with a larger entity, like a larger health system, they may have delegated credentialing with our health plan. Therefore, you will have to contact that entity managed care department. Now, if you're an independent provider and you want to contract with us directly, you simply go to pshpgeorgia.com. And once you click on the website, you click on For Providers. There's a drop-down menu. And then you would select Become a Provider. Once you click on that drop-down menu, you just fill out the provider contract request form. That information comes to us. We check your licensure, make sure you're Medicaid enrolled, and then from there, our paralegals send out a contract for you to read over and sign. Once we receive the signed document back, we'll execute the contract and send you an executed copy along with your effective date, and then our provider relations team will contact you to conduct a orientation, a new provider orientation.
Thank you. I wanted to let everyone know that we are recording this presentation and it will be posted in a recorded format, and the PowerPoint will be posted as well to the GAMUS website no later than November the 15th. Along with that will be the questions and answers. Even if we don't get to all the questions that have been typed in, they will be addressed during on that question and answer handout. There may be some questions that are more specific, so we will be getting back then to that particular person if they had a really specific question about a specific claim. Catherine, did you have any other questions that you were going to cover in the general format?
I do. Just a couple more, Brenda, and then we can go to the questions in the Q&A box. We had several providers submit the question, have Peach State and WellCare merged? And so that's an easy question that DCH can respond to. Peach State was actually acquired WellCare through its Georgia market, just in Georgia. And that occurred, the full transition occurred on May the 1st of this year. And so as of May the 1st, members, actually as of March the 1st, members were given an opportunity to select a new CMO if they chose to do that. If they had not selected a different CMO by May the 1st, they were directly transferred to Peach State Healthcare. At that point, the two organizations were completely merged and considered to be one. There's one more generic question that it might be interesting for all of the CMOs to respond to, or they may not have determined yet what that might look like. As you know, DCH opened up telehealth completely during the public health emergency and has allowed telehealth for any service that can feasibly be performed via telehealth during the PHE. Many states at this point are trying to figure out exactly how much telehealth will continue and what services really should be provided face-to-face. There's a couple of questions that were sent in before today that have to do specifically with whether the CMOs are considering the future of telehealth and if there's any look by the CMOs at this point about what that might look like after the end of the public health emergency. Would any of the CMOs like to respond to that one?
Amer Group, Vivian, Scott, do you want to go first?
Yes. So at this time, we continue to follow all directives during the public health emergency. Beyond that point, we have not reached any final decisions regarding that beyond those services that existed prior to the public health emergency, but it is something we are evaluating.
Thank you. Go ahead, Caresource. I'm not sure if Liz or Tony or someone else wants to take that.
This is Tony. I don't have any specifics on telehealth. Again, of course, we're going to follow all the guidelines, but we can take this back and provide some additional information regarding the future of telehealth and how we plan to continue to utilize that. So we can take that away and provide some detailed information after.
Okay, thank you. And of course, Peach State.
Yes, good morning. Again, we'll continue to evaluate, but we are definitely going to follow the protocols from DCH and also currently the public health emergency, but no final decision at this time, but we will follow in lockstep with DCH.
Thank you. Okay, go ahead, Catherine, if you have another.
Thank you, Brenda, and thank you for all three of the CMOs for taking a stab at that question. I will say that state Medicaid agencies now are really grappling with this, and so It didn't surprise me to hear that the CMOs have not made any determinations. And we will certainly be getting with them in the next few weeks to develop a plan for the rollout of the public health emergency, which, of course, that's unpredictable. None of us exactly know when that's going to be, but we definitely need to develop some solid plans. And we know that you all are waiting for all of us to do that. I'm going to go ahead and, Brenda, let you ask some questions now from the general questions that are coming in from the mailbox.
Okay. We have one specifically for Caresource. Are there BH, behavioral health quality enhancers? And that is specifically for Caresource. And as I should say, these are coming, at us cold. So if we don't, we may not have an answer today. And if we don't, that's fine. Like I say, we will be researching those and getting you answers to these questions. But Tony or Liz, do you have anything to add to that?
So currently, for behavioral health specifically, and the quality enhancer that Liz spoke about today, is not targeted to our BH providers. But again, it is something that we're looking at, and we'll pass along more information. But the program that we looked at today was not specific to BH.
Okay, thank you very much. I'm not sure who this would go to, but the question is, who is the Simpatico representative, and can we get the contact information?
Yes, good morning. This is Andre here at Peach State. Can you unmute Remy Rodriguez, please?
Yes, one moment.
Thank you.
Remy, you should be able to unmute yourself at this point.
Yes, good morning, everybody. This is Remy Rodriguez, the VP of Behavioral Health with Peach State. We have several behavioral health provider representatives for Peach State. The territory list and contact information is on our website under behavioral health webpage. But you can always certainly contact me. My email address, Catherine, would it be best if I put it on the chat? It's a bit long to be contacted, or it can also be found on the website under the territory list. Am I able to put it on the chat?
You should be able to type it in the Q&A and as a public, and then it would be able to be viewable by all. And if not, once you put it in there, I will copy and paste it into the panel.
Okay, thank you. I will do that, or else, like I said, all the territory and including all of our contact information are on the Beach State website under behavioral health. Thank you for the question.
So that brings up one of the questions later on was for each of the CMOs, how to get in touch with their reps. And so if the other two want to address that now, that would probably be a good time to do such. And I know you may have already addressed it during your presentation, but this is one of those questions that we've gotten asked a couple of different times, a couple of different ways. So if Amer Group would like to just give us a brief synopsis of how they can contact their provider reps.
Thank you. Yes, we also maintain a list on our provider portal that it is under a section that says contact us, and our representative list for both contracting and servicing is available. It's identifiable by the county in which the provider resides, and both the email and phone number for that representative is included on that contact list, as well as the management team. And so you can find that on the Georgia Amer Group provider web portal.
Great, thank you. So Caresource, go ahead.
Yes, thanks for the question. Caresource, very similar. On caresource.com on our main web page, if you click on the providers tab and then contact us, it brings up a list of a large number of contact information, but there is a link that states you can reach us by contacting one of your contracting managers. So you click on contracting managers and it brings up the territory map. So you'll see the specific rep, the areas that they cover, and their contact information.
Perfect. Thank you so much. So here's another question that is specifically for Caresource. It says for non-delegated providers, are the effective dates based on the Cmos 7400 file, or are they dictated by you? So I don't know if somebody from Caresource can take a stab at that. I'm going to repeat it again. For Caresource, for non-delegated providers, are the effective dates based on the Cmos 7400 file, or are they dictated by you? We're talking about the effective dates. Go ahead.
In a scenario where a provider may be credentialed with the state for some time, but they may not be contracted with Caresource, so the effective date wouldn't go back to when they credentialed with the state. It would actually be based on the contracting process. So again, if a provider has been credentialed with the state for a couple of years, but they contract today, the effective date would not go back to that 7400 date. It would actually be a Caresource effective date.
Okay, great. The next question is specifically for Amer Group, and it is kind of a broad question, so we may not be able to answer it today, but I'm going to throw it out there to Amer Group. Has Amer Group changed the amount of free units given per calendar year?
Hi,
Sorry,
this is
Vivian, go ahead. Yeah,
Thank
it
you.
keeps putting you on mute for some reason, but go ahead.
Yeah, that's not a problem. I'm going to assume they are referencing behavioral health therapy units when asking that question. And we instituted that there were 20 free units beginning in 2017, and that amount has not changed. If they are referencing any other service type, then we would need to get that information and we would certainly get a response back to them.
Okay, thank you very much. So, let's see. We continue to get questions about the presentations, and we will be posting those if someone happened to join later after I said that. Is there, and this is something for each of the CMOs, is there a limited amount of time that the provider reps have to return emails or calls when we reach out to the rep and make that first initial contact? So we'll just go through again, starting with Amer Group with Vivian. If the provider reps have any kind of a turnaround requirement?
Yes, generally we do desire that any inquiries are responded to within 48 hours. Unfortunately, the reps are sometimes doing their visits and engaging with their day-to-day activities, but it is our expectation that we are responding within 48 hours.
Great, thank you.
When possible, thank you.
Of course, okay. Caresource?
Yep, very similar. 48 hours definitely our target. We try to acknowledge receipt before that, but that's definitely our target. Again, that means acknowledging the request. That doesn't mean we'd have the answer that quickly. We'd always like to have it quickly, but anyway, 48 hours is our target. But we really strive to beat that in all chances. So, thanks.
Thank you. Go ahead.
And good morning here. Pete said it is 42 hours for general inquiries. Of course, we would like it quicker than that, but 48 hours is what it is at Peach State Health Plan.
Okay, thank you. And I had a question here. Is there a specific time weekly that eligibility of members is sent from DCH to the CMOs? So maybe Catherine can address that.
Could you read the question once more, please?
Sure, one moment. Is there a specific time weekly that eligibility of members is sent from DCH to the CMOs?
I'm going to ask the CMOs to correct me if this is not right, but my understanding is it is sent daily. And I am perfectly fine with being corrected. Thank you,
No,
Tommy.
I was gonna agree with you. So daily, that's correct. Yep.
Thank you so much, Tony.
You're welcome.
Okay, the time is 9:58, and I know that you probably have you want to get signed in for your 10 o'clock. Did DCH have any closing remarks that you'd like to make?
Yes, and Brenda, I'm going to ask for your input on this one, so don't mute yourself, okay? I just wanted to say that we received a number of questions prior to the today's Medicaid fair, and I grouped them so that I could try to ask the CMOs to address them in groupings to save time. We realize that there's still a number outstanding, and there are a number of questions in the Q&A box that are outstanding. We wanted to let you know that we'll be asking the CMOs to address all of those questions, and we'll be posting them. And Brenda, they'll be posted on provider notices in that section of GAMIS?
That's correct, under provider information, provider notices.
Great, thank you. So we'll be posting the full Q&A listing under provider notices. And there was one other thing that I wanted to mention while we have 1 minute, and that is that if your question is very specific to a particular CMO, what we will likely do is ask Gainwell to please identify your provider contact information, and we'll have the CMO respond to that question directly, and we're happy to send it to you, but rather than post it, if your question is about or directed to a specific CMO, we'd like to respond to that directly to you. And so that's what we'll do with regard to all of the questions that we get. Post the general ones in the provider notices section, and the specific ones will come back directly to you. Thank you.
Thank you, Catherine, and thanks for everybody's participation today. We didn't get to all the questions, and there were, like Marva said, I think about over 400 people on the call. So we know that you have a lot of things that you want to get answered, and we want you to get those answers. So we will be reaching out to you either individually or check the provider notices. I do expect it'll be posted before this, but absolutely no later than November the 15th is when that will be there for you for the questions. The presentations will be posted likely much well before that. So thank you again for everybody and enjoy the rest of your day and the rest of the Medicaid Fair.